My name is Eric Helfer. I'm a urologist at Christie Clinic and Provena, specializing in robotic prostatectomies. Did I always know I wanted to go into medicine? The answer is no. I started off my college career in accounting/business and did not do well my first semester. I always enjoyed science when I was in high school, and my girlfriend at the time, who's now my wife, was in pre-med and kind of convinced me to take some pre-med classes, did well, and here I am today. As a urologist, I like to specialize in prostates, whether it's prostate cancer or enlarged prostate tissue. I also specialize in kidney stones, whether patients need lithotripsy, which is shockwave treatment for kidney stones, or ureteroscopy, a small instrument to retrieve stones, or sometimes patients have large stones, so we put a tube into their back to remove the stones. As from the female side, we deal a lot, or I specifically deal a lot with what's called stress incontinence, leakage of urine with laughing, coughing, and sneezing, and it usually requires some type of surgical procedure to fix. The Da Vinci is it's a minimally invasive procedure for prostate cancer, essentially removal of the prostate. It's essentially the same surgery as open surgery, but it has more benefits. Smaller incisions, so the patients recover faster. There's less time in the hospital. Compared to the open surgery, patients usually need to take about 4 to 6 weeks off of work. I tell patients from the Da Vinci surgery it's about 2 to 3 weeks off from work. Theoretically, there's less blood loss with the Da Vinci surgery compared to the open surgery. I think I can spare nerves better so that patients have better erectile function after surgery. And I think the continence rate is slightly higher with the Da Vinci compared to the open surgery.
About that.
PSA test is a blood test to screen for prostate cancer. PSA test came into popularity in the early 1990s. Before the advent of PSA, men who were diagnosed with prostate cancer unfortunately were diagnosed at end-stage disease, so that we really couldn't really cure them like we can today. So PSA is a simple blood test. We recommend screening potentially at the age of 45. If patients do have a family history or are African American, sometimes we recommend at the age of 40 just to have a baseline test. If it is elevated, then we're concerned about prostate cancer, but because someone has an elevated PSA doesn't exactly mean they have prostate cancer. Urology, the reason why I chose urology, I always knew I wanted to do some type of surgical subspecialty. When I was in my 3rd year of training for medical school, we're required to do a little bit of trauma. And so where we did trauma, we had a lot of gunshot wounds, knife stabs, and it had been a long day. At about 2 o'clock in the morning, we had to take a patient back to the operating room to explore his abdomen to see what was going on. And so we realized that there was a kidney injury. And about 2 o'clock in the morning, the urology team came in. They were laughing. They were kind of cracking jokes. They were very serious, but they were also, we could tell they were enjoying what they were doing. And so I turned to my medical student at the time and said, I got to figure out what those guys are doing, because something's going right there. And so I looked into urology, and it's been a perfect match since. I'm married to Tamara Helfer. She's a gynecologist here at Christie Clinic. We have 4 children, 4 boys, from the ages of 10, 8, 5, down to 2. We pretty much spend most of our time outside of medicine with our family. I do have family here in town. Our boys are very, very active in sports, specifically hockey and soccer. And we just like hanging out with family and friends.